episode of the Ask Gunshila series, which is a patient education program. I'm Dr. Jyoti Menon, Director of Infertility Services at Gunashila Hospital, Bangalore. And with me, I have Dr. Rajam, who's one of the senior consultants at our hospital. Today, we are going to discuss something which is very common and which a lot of women generally complain, not really infertile women only. General gynecological patients also complain of this. And unfortunately, that's what we call as the periodic cry of the uterus, that every month, most people are, especially if you're a woman, you're fated to have painful periods. So, is there something which we need to worry about, or is it quite common? Is it something which has to be really looked into initially? All this, Dr. Rajam will go through the whole presentation. And if you have any questions regarding this, you can text in your questions either during the program or you can write to us at ask@gunashila.com. Okay. So, Rajam, how come all women don't have painful periods?
Most of us will have some cramps and some discomfort. That's very quite common during periods. But almost more than 50% will have a painful period. Painful period which lasts for 24 hours, they have pain in their tummy or in their back or into their lower legs, which will not allow them to do their normal activities in a very effective way. And almost 10% of women will have very painful periods which will not allow them to do their daily routine also.
Which I've heard of people even becoming bedridden for those 2-3 days.
2-3 days.
So
they don't
really
go to school.
Yeah, they won't go to college. They won't go for
work.
And this is something which is really distressing because every month, and I think sooner or later they will think, oh my God, why am I ever getting periods? Because they don't look forward, or that nobody enjoys having pain.
Having a period.
Yeah. So what could be the major reasons? Are there any different causes? Are there different types?
Yeah, there are two types actually. One is a primary dysmenorrhea. The second one is a secondary dysmenorrhea.
What do you mean by primary?
Primary means there is no problem in the uterus or in the pelvis.
Yeah, that means they get it from the time they start their periods.
And over time, they tend to get adjusted to the pain. And over time, people say it gets better, primary dysmenorrhea, because they don't have a pathology anywhere. It's just they are too sensitive for the periods pain.
There is also some kind of a myth that if you have very painful periods, either you should get married or you should have a baby and then it goes away. Is it like that? Because there is something like secondary also.
Yeah, there is something called secondary, in which initially your period pains were not that severe, and then as you get period pain, slowly it becomes worsening and it incapacitates you from work, and it doesn't stay for 1 or 2 days. It stays more than that, and usually in secondary dysmenorrhea, there is something associated with the
there's more pathological. There's a cause.
There is a cause. There is something in the uterus or something in the pelvis which is causing that problem.
So it happens little later.
It happens in little older women. It happens, and it tends to get worse, and at times goes by unless you diagnose it and treat it properly.
And I think it's more distressing because these women would not have had painful periods earlier.
Previously.
So they cannot understand why suddenly the painful happens, because if they've had painful periods right from the time they started their menses, then they accept, okay, this is a part of life and this is how it's going to be. Yeah, but unfortunately when they get it later, then they think. So what exactly if suppose somebody does come with the painful periods, is there something which when exactly does it happen, and which are the ones they have to really pay more attention to?
See, it happens just a few hours or a day before the period starts, and it stays almost 24 hours to 36 hours. It should not stay. Once the period flow starts and the lining sheds, it should go away.
If it not sort of persist towards the whole day, 3 days of the period or the 5 days of the period.
5 days of the period.
Then it's more significant that there is a problem.
And it starts up 2-3 days before the periods only. Then really there is a problem which needs to be addressed.
Okay, and there is also a very common myth that everybody says that, okay, you're born a woman, if you have painful periods, you must suffer it.
No,
is
it
like that? And I don't believe it. I just believe that everybody who has any kind of pain should get some pain relief.
Some help. They should get some help.
So, and then if we want to understand why the painful periods happen, is there any cause? known cause, unknown cause, common cause?
Normally, periods is just shedding of the lining of the uterus. Like you shed the lining of uterus at the end of your cycle. Like if you are not pregnant, you shed the lining of uterus. Prostaglandin is one important chemical which helps to shed the uterine lining, and it helps to reduce the bleeding also. So some patients they secrete more prostaglandin. Prostaglandin is also a pain chemical. That is the chemical which causes pain. And some patients, some women, they have more prostaglandins or they are too sensitive to the prostaglandin secreted.
Which can still be normal, but they're extraordinarily sensitive. Oh.
And some have a familial history, like if their mothers or grandmothers have painful periods, they also tend to have painful periods because the sensitivity is more in them.
So it can be, there can be a cause or there need not be a cause. And again, pain tolerance is another one.
Yes,
some people, even with the slightest amount of pain, are not able to tolerate. Some people can manage a bit of pain, but again, I want to emphasize that it is not a must and should that you have to suffer the pain.
You should ask for help.
Yeah. So if you go, main causes, especially if you want to look for persistent painful periods or very severe, long-lasting painful periods, there are some causes. And what are the common causes?
The common causes would be endometriosis, adenomyosis, fibroids, and pelvic inflammatory diseases.
So these are basically, when we talk about endometriosis and fibroid, there's something to do with the uterus.
With the uterus. There is some pathology in the uterus. And this is a picture. The first picture says how a normal uterus and tubes and ovaries should be. And the second picture shows the tubes are little swollen. The lining of the tube is little inflamed. That's called a pelvic inflammatory disease, or there is some infection in the uterus or in the tubes which causes fibrosis and scarring and makes the painful period. The third picture is of an endometriosis. Endometriosis is nothing. Endometrium is the lining of the womb, and when the lining of the womb goes outside the lining means it goes into the uterine lining, uterine musculature, or it goes to the ovaries, or it goes into the pelvis outside the uterus. If there is a uterine lining, that's called endometriosis, and usually it causes very severe painful periods.
Yes, because normally, like we all know, whenever you're going to have menstrual bleeding, it is going to come out through the mouth of the uterus into the vagina and outside.
Yes.
That is what normally, antegrade as we call it. But in some women, along with coming antegrade, it goes backwards, retrograde, and that is how it goes through the tubes onto the ovaries.
And to the ovaries,
and
pelvis.
Pelvis, and forms very painful cysts in the ovaries, which are called endometriomas. And all this can be a major cause of severe painful periods. And the last one is?
One is the fibroid. Fibroids are just benign. Benign means they are not very harmful, but they are swelling or they are growths in the musculature of the uterus. And when you have multiple fibroids, they also cause painful periods.
So all this, again, we want to emphasize, maybe initially, especially if you're a young lady, you're not married still, if initially you've been having painful periods which you feel are manageable, but they are becoming worse. Then maybe some pathology is coming.
And you
need to consult a doctor.
Ask for help.
Are there any, simple measures we can take whenever we want to, whenever any woman has some kind of
pain? Any kind of period pain, you can relax, get some rest, or do some massage with some essential oils like lavender oil or eucalyptus oil.
Basically for
relaxation. Relax yourself. You can take a hot shower, use some hot water bottle, but make sure it's not too hot to burn your skin. And you can do some exercise and yoga. There are some yoga postures which relax the pelvic muscles and make the women feel better in.
And meditation, I think, also helps.
Meditation also helps.
Stress relief, basically. Yeah.
And you can take basic painkiller tablet like paracetamol. And there is a group called NSAIDs, which when we were talking, we told prostaglandin is the chemical for causing pain. So anything which goes against the prostaglandin is
which will reduce the prostaglandin level. And NSAIDs belong to that
group. So you can take 1 or 2 tablets a day to relieve the pain. There is no harm in taking tablets with a prescription. And within the limited doses. It's not like you pop tablets just like that, 4, 5 like that. 1 or 2 a day with a prescription is good. It's like you have to take it to...
Yeah. And like I had already mentioned earlier, it's not necessary that you suffer the pain.
Yeah.
And also what I have found out in my practice is that initially when you know that you're going to get pain. So when the pain is initial, just starting, if you take the tablet, it will not become so severe,
Severe.
nor will you require so many tablets.
So many tablets.
Whereas
Nor
if you
will
wait for it to become really severe, you'll have to take many more tablets and for many more days.
many more days you need to take, and you will feel better. And when you feel better, your work life, your quality of life is also better. And certain women with certain disorders like bleeding, asthma, allergy, or some liver problems, or when you have gastritis, should not be taking these tablets. And when they are taking, they have to take some precautions and how much they should take and what tablet is safe for them. You should know that and then take those tablets.
So,
And you can use a combination of tablets and natural methods also. They say herbal teas help, and with cinnamon or fennel seeds that help,
yeah.
and some acupressure also helps, they say.
So we can try all that, a
All that.
combination of various lifestyle modifications. Then
And whatever is accessible to them also.
correct, and like not only allopathic drugs, maybe some whatever suits you best, but should give you pain relief.
Pain relief.
Okay, so if okay, you have pain, you're manageable, but then it's becoming very severe, lasting very long. So when should really a woman who's having very painful periods visit the doctor?
If it's incapacitating her work, daily routine, she can't go to school, she misses office for 2-3 days, and it's becoming worse. Even after the period goes away, the pain doesn't stop, and it starts 2 to 3 days before the. Even
Probably those are the patients who really need to seek medical help earlier. Than other people who just have it for half a day
and
or
if you
1
get
day.
relieved with some natural method or with one tablet, then it's okay. If you're not relieved with tablets, not relieved after taking natural methods also, it's not relieved, then definitely you should go and see a consultant.
Okay. Any other?
And even if the pain is associated with severe bleeding, if the pain is associated with other symptoms like painful intercourse, or a painful defecation, or a painful micturition, if it's
So something in the pelvis,
something
because
in the
along with the
pelvis.
uterus, the surrounding organs, whether it is the bladder
Bladder.
or the rectum, also are being affected. That is why you are going to have pain
Yeah.
in all those areas.
All those areas, and a difficult coitus. If it's associated with all those things, then also early you should see a doctor.
Then you know that there is something really, some pathological problem in the pelvis. So you really need to go and consult a doctor earlier. So when they come to see a doctor, what exactly is the procedure which we would follow?
So first, initially we take a history, like how the pain come, how from maybe a menstrual calendar, we should go through her menstrual calendar, how her periods are, how her pains, any
every
associated
period she's getting, every period does she have pain,
how many days she's getting, associated symptoms, and any other medical or surgical problems previously she had, any allergies, everything we will ask. First a history, then we will examine her, her tummy we will touch and see any other swelling, or if she is married and if she's sexually active, we'll see the vaginal examination also, we'll see to know what's happening. And the third is an ultrasound.
For unmarried women, we can still do an abdominal
ultrasound. For a married woman, we do a vaginal ultrasound to know what's really happening.
So these are the three basic things: a history, an examination, and an ultrasound. Okay. Once we suppose we find that there is a problem, there is any other problem which can be associated with period pains, can we pick up early if there are associated problems?
Yeah, like what we have.
For fertility, yes.
So certain problems like endometriosis, fibroid, and pelvic inflammatory disease, they can
affect fertility later, even if you are unmarried.
Yeah, they will not allow a lady to become pregnant because they will have this thing on the other parts of the uterus also, uterus, ovaries, and the tubes. So a patient who has a pain which is incapacitating her, or which is associated with endometriosis or adenomyosis or a pelvic inflammatory disease or fibroids should get it treated in time, should get it diagnosed in time and treated in time to restore her fertility. So if she gets it treated in time, maybe there will be no problem in having kids. If she leaves it just like that, maybe there will be problems in her reproductive health and problems in her pregnancy also.
So that is why, in our practice also we have seen, Rajam, even when they have come with severe pain, and we have unmarried girls have come with severe pain, and we've done an ultrasound, found out that there are endometriomas, we have said that yes, depending on the size, we just decide whether they need to go on medical treatment, or if it doesn't, we have to do surgery. And we've had experience where many of them, once we've been able to manage them both medically and medically only, or medically and surgically, and put them on subsequent medication also, when they have come back for fertility treatment,
Treatment,
it
it's
isn't
been
so bad.
it's easy.
Yes.
It's easy
So
for
that
them.
is it's much better for them to conceive than if at all they had not had come to for clinical examination even earlier. Okay, now suppose they have secondary dysmenorrhea. That means they have not had dysmenorrhea initially part of their menstrual cycle. In later on, they develop it as they grow older or after childbearing. Are there any causes? What is the main this thing like we had discussed earlier? Adenomyosis and fibroid, which can come.
Yeah, adenomyosis is just like it's a similar to endometriosis, where the lining of uterus goes into the muscle wall of the uterus. Adenomyosis also causes severe periods pain, and it can cause heavy bleeding also. So if there is adenomyosis, then they also needs to be treated to improve their quality of life and to improve their work performance, everything. And the treatment for all these secondary dysmenorrhea depends on the age of the patient, whether they are married or not, whether they want to have children or not, or whether they have completed their families, or if they have any associated problems like bleeding or any other problem if they have. Depends on everything we plan a treatment. It's not like if it's adenomyosis, this is the treatment.
So surgery is not the answer for everybody.
Everything. It can be treated medically also. And if surgery is required, you should not hesitate to go for the surgery, because it improves the reproductive health
And
as well as
quality of life. Yeah, but then
And,
surgery is the last option after everybody has this thing, the all medical treatment.
and there are intrauterine devices also. If you have completed the family, hormonal intrauterine device, you don't have to take tablets. Intrauterine device which can be put in for a 5-year period, so they'll be pain free for the 5-year period. So those are also there.
Yeah, so other options, it can be oral tablets, it can be injectables, it can be intrauterine contraceptive device. And then last option
is
definitely would be surgery. Okay, and
the most important is people in the reproductive lifespan, when they have a painful period, they should not ignore, and they should not brush it off as normal. They should go and seek for help, because their reproductive life or reproductive health is dependent on their conditions in the uterus and the ovaries.
See, at least they get reassured.
At
if
least
they come initially and we do the history and we do the examination and we do an ultrasound, find everything normal, at least we can reassure them and say, nothing is there. You don't have to worry, nothing immediately. You can try on your own for a little while.
I don't require medication.
Yeah, or maybe just little painkillers during the painful periods. So as far as fertility is concerned, that will at least reassure you that there is time for you to try on your own.
And if there is something, at least you know it early.
Correct. You can take an early action both from your side as well as the doctor can also help you, guide you in what's to be done. Okay, then what is it? We have a very common this thing called, like, women have that mood swings and all. What is that actually called?
It's
just
called
before menses.
Premenstrual syndrome. Like you get it a week or 10 days before the periods. Like you have mood swings, you have nausea, you have bloating, breast tenderness, and you become irritable, and you have loss of appetite, loss of libido. So this happens, but all these things can be managed by natural way, by relaxation, by doing regular exercise, eating a healthy, balanced diet, and doing yoga, meditation. In a lot of general ways, it can be reduced. And if it's not reduced with the natural ways, then you need to consult to rule out that there is nothing pathological. Nothing pathological like we previously discussed is there, or no psychological aspect associated with it. If there is a psychological aspect associated with it, then you need little counseling and little anti-anxiety medications to bring down it, and you will feel better with it.
What about the evening primrose oil? That is another thing they keep telling you all. No, how effective is that? That is also just a supplement.
It's an adjuvant kind of thing. For some it may help, for some others may help.
Yeah, like massages and lifestyle changes, basically
it's lifestyle changes, and you lead a healthy, balanced life.
Yeah, and reduce stress for whatever reasons you can. So if we take it like that, basically that this is the thing for PMS. So I think we have sort of covered most of it. And you also said that in secondary amenorrhea we can also have laparoscopy, hysteroscopy if we want. As diagnosis. Just to make sure that we are not, dealing with anything pathological. But otherwise, just want to emphasize that painful periods is something which is natural. You can take medication as and when required. But if it is very heavy periods or lasting very long, then you must seek medical help.
And diagnosing early
is important in order for your future reproductive life. So that is basically what we would like to educate all of you at the end of this
last slide,
session.
please.
Yeah. So our
There are some do's and don'ts.
Yeah,
ma'am.
please.
In painful periods,
painful
there are
periods, some do's and don'ts.
You
She
can
will
take
summarize.
painkillers in a very like you can take painkillers in a very like you should take it for 1 or 2 days, 1 or 2 doses only with a prescription, and you cannot just pop in 4 or 5 a day. In a judicial way, you should take the painkillers, and relaxation with yoga and meditation, and a proper sleep for 7 to 8 hours, with having a healthy balanced diet with regular exercising help to improve the periods pain. And if it is pain without any problem, then all these things will settle down the periods pain. And having a menstrual diary for at least 2 to 3 menstrual cycle will help you to know like whether you need to seek help or all these natural methods, and with little painkillers the pain will come down,
So that you will be able to, you will be noting exactly when the pain starts,
When
when
the
it becomes
pain-
worse, when it ends. So if the same thing is repeating cycle after cycle, then you better go and see consult a physician at the earliest.
persisting and recurrent pain, please consult a
Yeah.
doctor. And do not drink too much coffee, refined sugars, avoid salty food, avoid carbonated drinks, do not drink too much alcohol, and don't smoke. All these things, all these don'ts will help you to get reduce your periods pain.
Yeah, and I just want to add one more thing for premenstrual syndrome. They say, because basically the whole thing happens because you're getting edema in your body, whether it's in the
Bloating.
pelvis, the bloating sensation or that. So that is the time when you have to be a little more careful about your fluid intake and your salt intake.
Salt intake, less salt.
Yeah. So
Carbonated drinks avoid.
Correct. So
And
we have
lot of fruits, vegetables.
Correct. Balanced diet. So that is what we would like to come to the end of this session, and just want to tell you all.
I have PCOS and still get my periods regularly. Can you speak about it, ma'am? Yeah, there is a subset of women who have PCOS, and there are different phenotypes of PCOS. PCOS, there are 4 phenotypes. Like, not that everybody should have an irregular period to tell them as PCOS. If you have hyperandrogenism and polycystic appearing ovaries in the scan, then only you are called, then also you can be called a PCOS. So you can get regular periods in PCOS also.
Yes.
But to tell you, to diagnose you as a PCOS, you should have high androgen levels, high male hormone levels in the body, and also you should have polycystic appearing ovaries by scan. If these two are there, and still if you get regular periods, you can be called PCOS.
And I think, Rajam, we are going away from our topic, but I just want to say this PCOS itself is a very misunderstood concept.
Yeah.
Because everybody says, okay, scan PCOS. No, there are so many factors which come into play before you diagnose a person as PCOS.
And a PCOS patient, the spectrum of presentation is also different. Not everybody will have everything. Few will have irregular cycle, few will have short cycles, few won't get periods at all. It's like that.
So regular cycle, and you can still have regular cycles and have PCOS, provided you have the ultrasound picture or your androgen biochemical levels are abnormal. So that we have to go into a full topic of PCOS.
Maybe we'll cover
it in another session. Are there any other questions which are related to our particular talk today of dysmenorrhea? Okay. Then thank you all for listening to us. You watch out for our next program, which is going to happen on 5th of September. On fertility preservation in cancer patients by Dr. Devika and Dr. Ashwini. And whatever questions you have, you can write to us at ask@gunashila.com.
Thank you.
Thank you very much.
Thank you very much. It went fast.
Simple.